Hello again and welcome to our final module. I'm Abigail Echohawk, the Associate Director of Partnerships for Native Health. I will be your guide today as we offer facilitator tips for Module 6 of Staying in the Circle of Life curriculum. Let's get started. Module 6 of our Staying in the Circle of Life curriculum is titled Family History and Genetics. This is the final module in our curriculum, so we have added a closing discussion to this session. It is our hope that, by now, the participants of this curriculum have formed significant connections with each other. The closing discussion is a great opportunity to solidify these connections. The first part of Module 6 introduces the concept of family history and genetics. As the facilitator, you will introduce not only the definition of family health history, but you will highlight the importance of knowing one's family history of disease. Family health history is medical information about diseases and conditions that affect members of your family. Consider beginning the discussion with a question. For example, ask the participants why family health history is relevant. What potential benefits could the collection of family health history have for an individual, for future generations? Highlight the concept of preventative health services. For example, if you know that colorectal cancer runs in your family, does that knowledge change when and how you are screened for this disease? It should. Encourage participants to discuss what family health history means to them. Ask the group, why would we want to capture this information? Does it have meaning beyond ourselves? The answer is yes, it absolutely does. Collection of family health history can impact not only how we live, but how our children live and how our children's children live. However, you may need to be sensitive to potential challenges inherent to the discussion of collecting family health history. Let me give you an example. Not everyone has access to or is comfortable talking with members of their family. If this comes up in your group meetings, brainstorm some ideas of how people could develop their own family health history, even if they do not have access to their parents' or grandparents' stories. Remember to communicate that it's never too late to collect your family health history, and you can always begin with yourself. Beyond environmental and behavioral factors that impact a person's health is a person's genetic predisposition. People inherit a complete set of genes from their mother and their father. These genes are thought to directly or indirectly a person's risk of developing certain illnesses. As a facilitator, note that genetic testing is not often the first step in developing a health plan. Rather, your family health history is probably the best place to start when trying to determine certain health risks. Of course, all of this information is great to collect, but it must be shared with healthcare providers. Overview Does It Run in the Family tool as the primary activity for Module 6. This tool offers a framework for the collection of family health history. It tells you what should be collected and what to do with this information. Encourage participants to complete the tool with their families. The remainder of Module 6 focuses on personal impact of this curriculum and group meetings. As the facilitator, this is your opportunity to really encourage connections within the group. Ask participants what has worked and what the group meetings have meant to them, but try to let the dialogue flow and just observe. In this module, as you have ended each of the previous modules with the closing circle, ask participants, what did you learn? What do you hope? What do you feel now that this curriculum is over? This completes our facilitator tips for Module 6. We hope you have found this to be useful. Thank you so much for viewing.